What I'm going to talk about today is, first of all, who am I? So I am a New Orleans native, and that means I am a Saints fan, living in Atlanta, which is Falcons territory. It's the worst place you can live to be a Saints fan. Okay, so I have fleur-de-lis all over, even on my dog's collar. I graduated from Oglethorpe University. Go Stormy Petrels. If you look that up, it's a mascot that you've never heard of. It's a bird they lit on fire to fly towards land back in the 1800s so they didn't get lost. I have about 15 and a half years of healthcare experience, 4.5 in the dental and vision insurance, as well as 11 years in finance. My responsibilities are basically data. I swim in it every day. So general ledger, payroll, costing, budgeting, financial revenue cycle, and any ad hoc reporting systems. Who is Emory Healthcare? Emory Healthcare has 10 nationally recognized hospitals in the Atlanta, Georgia area. We have 3 physician group practices, 20,000 employees, about 2,100 physicians, and we see about 4.1 million annual visits a year. Why Caspio? So in 2009, we implemented a decision support tool as Emory Healthcare, and I represent the physician group practice side. And there is a level of data that we need, which is the physician level. And that decision support tool cannot deliver it to us, so we need to look for a supplemental solution. So how we stumbled upon Caspio, my manager at the time had experience with it before, so he recommended it. I did a trial run, and while we did a trial run, these couple of things which stood out and said, yes, let's go ahead and use it. Rapid app creation, ease of use, similar to access database functions, quick deployment, and immediate availability to the end users. And that was key, was that we were able to create a data page, website, put it out there, and they can click and look at their data. Over the years, what we have done is style sheets. So we have many data pages, too many I can't count. So when someone calls and says there is a problem, we like to know what data page are you on. So we have style sheets that tell us if it's green, you're on an actual reporting data page. If it's blue, you're on a budget reporting data page. Also, we use authentications for our security-based apps, and we also use a lot of views for merging different tables together to make the processes more efficient to our end users. The results, like many of you, I spent many hours developing many spreadsheets, emailing many spreadsheets out, gathering everything back, compiling back out, many hours. Less productivity time for me. We don't do that anymore because of Caspio. We are also able to gather information quickly and easily. Examples of this are physician effort, billable patient time, monthly budget trends, as well as patient financial service question and answers. Now, for the patient financial service Q&As, we would just ask for the sections, our specialties, like cardiology. What are your plans for the next year? How are you growing in your department? We have also taken 2 paper processes. Now, literally, paper. You print it out, they fill out all the information, courier takes it to the next place, they get a signature, takes it to the next place. We don't have that anymore. Instead, these 2 processes are now in Caspio, and it's all email-based. Here's our main dashboard, and it's called Ethan, and it started off as a reporting dashboard. So if you look to your right, the green box was basically what we had at the very beginning, just reports. But we have expanded it. We've expanded it to workflow processes as well as data gathering processes. So when people log into the decision support tool, there is a dashboard available. They will see this, and they will be able to click on the button for what they need. What we have done so far from the reports is charge lag days. How long does it take a department to submit a charge after a patient visit? In Emory terms, we would like for that to be no longer than a couple of days. It shouldn't be more weeks. If it's weeks, we want to know why. Why is it taking weeks? We also have a report for finance control detail accounts. What this means is Emory is a very big organization. The departments are looking at their financials. They want to know, what am I being charged for? So they can look at the space, their rent. They can look at the assets, computers, MRI machines, and they can look at the malpractice premiums down to the physician. Another report that we do, which I'm going to show in a minute, is the rendering provider analysis. And here, what we are doing here is like, what are your physician productivity like? Emory would like for our physician productivity to be at the 65th percentile. So what we do is we say, okay, let's show you where are you at and what it will take to get there. It also shows to you who's performing the patient care. The healthcare model is changing. Okay, so what does that mean? When you call, sometimes you see a nurse practitioner. You don't actually see an MD. Sometimes you see a physician assistant. So we want to know who is managing their advanced practice providers, is what we call them, efficiently. This is an example of the rendering provider analysis, and I would like to use the term that this is something we call a drill-down report, which simply means you start at the very top, go down to the lowest level of detail. As you can see on the screen, this is for the section cardiology. The second specialty listed there, you can see that their benchmark is below the 65th percentile. And so you may not be able to see the tiny numbers, but what we give to them is what will it take to get to the 65th percentile as far as visits go. And this is year to date. So this is 11 months worth of data. And we also break it down to how many patients should you see a day to achieve this result. Now, the administrator is able to click on that link, and it will take them down to the physician. And so it will show the breakdown by physician, which physicians are at which percentile, and it also tells you who is rendering the care, who sees the patient. And so for this particular doctor, you can see that he's got about 77 who are seen by other MDs and about 136 encounters that were seen by other APPs. Now, who has seen those patients? What they do is click on that link, and it will take them down to the actual people that is under them, and they can look at the encounters to see who is helping this provider achieve his benchmark and who is managing their APPs, advanced practice providers, efficiently. Last thing to talk about are the workflow processes. So what we have done is taken paper, and we said, we don't want to do paper anymore. There is a better way. And Caspio gave us that platform to do it. Again, what we've done is we take this Memorandums of Understanding system, MOU system for short. And what this is Emory is a very big, robust organization. We have got 10 hospitals and 3 physician group practices. How many have gone to the hospital and you've gotten 2 bills, one from the hospital and one from the physician group practice? You got that? Well, Emory is no different. So if you go and have surgery at a hospital, there's anesthesia services. The clinic provides the anesthesia services. So the MOU system is a tool that helps the hospitals and the clinic negotiate how much to pay for the anesthesia services. Another paper-based process was capital expenditure requests. This one, what we have used is if you wanted to purchase a computer, or if you wanted to purchase an MRI machine, you had to fill out paper, and depending upon how much amount it was, it will go and get the required signatures. So MRI machine is millions and millions of dollars, which means that it had to go from the department manager to the CEO of Emory Healthcare for signatures. So what we've done is we've made that email-based so that now the executives can pull out their phones, look at their email, click on a link, and actually say approve or deny. This is an example of the CER system, the capital expenditure request system. What you see is the menu of what is available to do. You can submit a new one, transfer. You can look at your CER status. Where is it in the workflow? As well as do some reports to look at your balances. How much money do you have left to spend? Another thing that you see is when they open up and submit a new request and you select your department, it tells you how much money do you have left to spend. If you don't have money to spend, you can't submit a request. The paper-based process, we actually were at the end of the 12. We weren't at the beginning of the 12. So if you submitted a request and had no money, by the time it got to us, we had to figure out how to get you money, okay, because you've already purchased it. Instead, it's like a bank account. If you've got no money, you can't pay the bill, you got to transfer money now, and Caspio has given us that opportunity in the submit transfer. Where's the money coming from? For this one, it's just an example of how the email works. So once the submission is made, an email goes out. And from that point on, we're talking to executives. They're not going to log into the system. Instead, they look at the email. They're able just to click on that link, and it opens up what you see on the other side. And they will scroll through it. They can open up attachments, and they can make a decision, approve or deny. Once that decision is made, another email is sent out. If it's in the next step, it goes to the next person. If it's at the end, it goes all the way back to the requester, letting them know what has happened. And then the requester then is able to forward that off to purchasing. And then purchasing looks at it, and they take it, and they can click on a button at the top that says, this has been purchased, and the email goes back to the requester saying everything is ready to go. Could not do this without Caspio and the ability to do automatic emails and workflow. Okay, so what are we doing here at Emory Healthcare for the future? So every year, my team continually improves the processes that we have. If we go back to that big main menu page, we have a lot of it in there. What can we do to make things better? How many clicks does it take? We like to do things in less clicks as much as possible. Okay? Also, we look at our tables because we are here to serve the end user, but for me, I need to make sure my employee engagement is good. So if it takes too long to do something, what can we do better? Table designs, data page efficiencies. One thing that we are doing this year is Emory Healthcare, every year, we budget for new physicians, and we recruit for them. But just like in every institution, we want to know what is the impact to the bottom line. So we're going to develop a physician performer tool. Right now, that is just one big, huge spreadsheet of collection of spreadsheets. And so what we are doing is taking this process, and we're going to use Caspio so that they can enter it in, and then there's two things that would happen. The specialty, cardiology, can see how many performers they submitted and what is the impact to their bottom line. And finance, me, I can look overall for Emory Healthcare saying this is the impact for the bottom line. And we are able to walk over, is what we call it, from this year to the next planning year. And how much is the impact? And that's it.